Thank you. Thank you, and thank you all for coming. Just a quick request. Please hold any questions until the end because they're recording the presentation, and so they don't want to record all your questions in case any of them are personal questions. And you can come up to me afterwards as well if you don't want to ask a question in the group.
Do you have a microphone?
I do, but I think it's on recording. I can talk loud, though. I was talking loud in the last one, and I'll move around. So my name is Angela. I'm here to talk about your pelvic floor health. And as I mentioned in the last group, when I'm talking about pelvic floor, I'm not talking about pelvic organs. So we're not talking about your uterus and your ovaries. We're talking about the structures that hold all of those things up and together. So what is your pelvic floor? Basically, it is the area that runs from your pubic bone all the way back to your tailbone. And I'm going to show you an anatomical picture in a second. But I want you to understand that it includes the female genitalia, the anal region, and then all of the muscles underneath. So basically, anatomically, what we're looking at is if you're lying on your back, this is your pubic bone. We run here, here's your urethra, your vaginal opening, and your anus all the way to your tailbone here. And if we peeled back the skin and the fat from that area, what you would see is all of these little muscles. And many women don't realize that you have a bunch of muscles down there. You know, you can see this muscle here, you can see the muscles in your thighs. You can't see these, and so when you're looking at this area, they just think it's your vagina, your anus, you know, your urethra, your clitoris, that sort of stuff. But it's actually a whole bunch of layers of muscles, and these muscles work together to hold everything tight and together so that you don't have leakage problems. So pelvic floor functions, there are 4 primary functions. The first function is sphincteric, and what that means is that it closes off these openings. So the job of your pelvic floor muscles is to close off the urethra so that you don't leak urine, and to close off the anus so that you don't have fecal incontinence. It's also supportive. Your pelvic floor muscles run horizontally across your body from right to left, and so they're some of the only muscles in our body that do that. So their job in that sense is to hold everything up and tight. And what I tell ladies is, you know, we start off with this nice tight pelvic floor when we're young, and then as years go by, it starts to get lax, it gets a little bit looser, we have kids, we gain weight, it gets a little stretched out, and it goes from being a nice tight hammock to being more of a bowl that just kind of holds things, but it's no longer holding them necessarily where they should be held. And so it's holding up your uterus, your bladder, and your rectum. And as you know, as the years go by, we start off, you know, we're young, we're standing up, nothing's pressing against there. We get pregnant. That's a whole lot of extra weight suddenly on there. We gain weight naturally as we age. That's more weight holding down those organs. And then we go through menopause, so we have less strength down there, and everything eventually just takes its toll on it, not to mention the gravity that we're holding against all day long. Your pelvic floor acts as a sump pump. And so what that means is that all intertwined in those muscles down there, there's a bunch of lymph nodes and lymph vessels. And so the way that your lymphatic system works is that when muscles contract, they open up those lymph vessels and they pick up extra lymph fluid throughout your body and protein, and they kind of transition it all throughout your body, filter it, and then you dump it out eventually. So if those muscles are not efficient at their job, you can actually start to have problems with fluid retention. Your legs might swell, your abdomen might swell. We see this very often in women that have had some sort of gynecological cancer. They've had some of those lymph nodes removed, or they've had some damage to that area, and as a result, they actually start to just hold fluid in that area. And then, of course, sexual. Your pelvic floor is very important in the sense that when you have good muscle tone and you know how to fire those muscles, they transfer blood to and from the clitoris, and that's what allows for sexual pleasure in women. So I know some people eventually get to a point where they're not so worried about that, but if you know that there's something you can do to improve your sex life, then why not do it? So what exactly is urinary incontinence? It is a condition in which involuntary loss of urine occurs. And there are 6 primary types that, and I'm mainly going to talk about 3 of them, but I'll kind of explain what each one is. But the biggest issue with incontinence is that it's a social and a hygienic problem. And by that I mean it's embarrassing. If you leak on yourself, the last thing you want to do is be worried that you're going out to dinner with friends or something and you're going to pee all over yourself if you drink anything. You're worried about smell. You know, urine smells bad, and if you feel like you're sitting there with a wet pad on all day long, you worry about smell. It causes skin irritation. You know, if you sat in a puddle of water all day long, eventually your skin's going to break down. It's the same theory, so it kind of causes some health problems as well. So the types of incontinence are stress, urge, mixed, which is exactly what it sounds like. It's a mixture of stress and urge, overflow incontinence, Functional incontinence, which I'm not going to talk about too much, but basically what that is, that's more of a mobility problem. That's the person who, for whatever reason, physically can't make it to the bathroom, either on time or at all. So I mentioned in the last group, it may be that it's someone who's in a nursing home and they're not ambulatory, and the aide can't get to them, within 5 minutes of them feeling the need to go to the bathroom. And so what do they do in a nursing home? They put you in a Depends. They put you in a diaper because they know you're going to end up using the bathroom on yourself. One of the best ways to handle a functional problem is what they'll do in a nursing home is scheduled voiding. So they might say, okay, Miss Jones, we're going to take you at 8 a.m. to the bathroom. We're going to come back at 10 a.m. We're going to take you to the bathroom. And we're going to come back again at noon and take you to the bathroom. And that's one of the healthiest ways to handle that in a population that can't get to the bathroom on their own. Because the last thing you want to do, like I mentioned, is let someone urinate on themselves and just sit there for an hour in it, because then they're going to have a whole host of other health problems. So stress incontinence is urine loss resulting from increased intra-abdominal pressure. So basically you sneeze, you laugh, you pick something up, you're exercising, and when you do those things, it makes you tighten your abdominals and push down. And so when you push down, it puts pressure on your bladder here, and as a result, you leak out a little bit of urine. So the main thing with stress incontinence is that it is typically small amounts of urine loss. This is not the, I'm standing there, I sneeze, and I just completely empty out my bladder on myself, or I'm standing there and I do nothing and I completely empty my bladder out. This is more of you're doing, you pick something up, you stand up, and you feel a little dribble, and you might, kind of do this sort of thing. We call it the pee-pee dance, and you're trying to hold it in. You're trying to clamp it off yourself because the muscles aren't doing it. The good thing is it's usually caused by weakness, and we can strengthen those muscles so they can combat these forces that we're pushing down. The muscles can pull back up if we train them properly enough so that it can close off your urethra and prevent you from leaking the urine. Urge urinary incontinence is a little different. This is the type of incontinence that occurs from an involuntary contraction of the bladder. So basically what happens is the signal between the bladder and the brain gets a little messed up, and the brain is saying, okay, bladder, you're full, and it squeezes. The bladder is a muscle, but it's not a muscle like our bicep or our quad. It's not a muscle we have control over. It's involuntary. So there's this nice neurological loop system that we have in our bodies that says, okay, bladder is full, brain says, okay, pelvic floor muscles relax, bladder squeeze, empty out urine. The problem is sometimes that happens at the wrong time. This is the type of person where you probably heard we talk about key and door syndrome. You come home, you're doing fine, you walk to your door, you put the key in, boom, you peed all over yourself. The reason for that, it's often associated with a trigger. So it could be you're standing there minding your own business, someone turns on the kitchen sink, boom, you peed all over yourself. These are triggers, and so as a result, there's a neurological process that occurs, and over time, your brain thinks every time it hears running water, it's supposed to cause your bladder to squeeze and your pelvic floor to relax, and this is associated with a large urine loss. So it's usually the bladder squeezes, and it empties out completely. The good thing is that it is also treatable. Very often medications will help with this because the medications don't help with the stress incontinence because that's a weakness issue. But with urge incontinence, they can help to calm down that bladder so that it doesn't contract so much. The problem is it comes with side effects, dry mouth, dry eyes. I mentioned in the last group that medications don't treat one thing. When you take a pill, it's systemic, so you're going to have to deal with the side effects of it. The other things you can do, learn to relax, which sounds counterintuitive. You would think, I've got to go, the last thing I need to do is relax. But if you can relax, sit for a few minutes, and then if you still have to go to the bathroom, then walk to the bathroom, that eventually will train your bladder and your brain so that it's not saying, go now, and contracting. But you do it gradually. It might be, week 1, I mentioned, you hold it for an extra 2 minutes, and then if you feel like you have to go, walk calmly down the hall and go. Week 2, hold it for 5 minutes. Week 3, hold it for 10 minutes. And eventually what happens is you can retrain that signal between the bladder and the brain so that the brain is no longer telling the bladder to contract and empty out when it shouldn't be. What can happen is anatomically, this over time, if you're letting it empty out frequently or you start going just in case, the bladder will shrink. So instead of your bladder having this capacity to fill up, it has this capacity to fill up. And so you will literally drink, half a cup of water and suddenly feel like you have to really, really go. And you might really, really have to go because your bladder can no longer hold what it should. The good thing is your bladder is like a little balloon. It can be stretched back out again. So if over time you can gradually increase the time between trips to the bathroom, you can get it back to its normal capacity. It just takes time. This doesn't happen overnight, and fixing it doesn't happen overnight. So you have to be patient and be willing to kind of go through the process. Doing Kegels, will help to relax your bladder. So if you feel a strong urge to urinate, squeezing those pelvic floor muscles, which I'm going to go into depth in a minute about that, that will actually help to relax them. And using distraction techniques, I mentioned in the last group, don't distract yourself by thinking about, being on the beach in Hawaii or looking at a waterfall, because that will not help when it's a bladder issue. Think of yourself in the Sahara Desert, okay? Put yourself somewhere dry. Let yourself get away from the thought that, because you get so focused that, oh my gosh, I really have to go, and you sprint down the hall and you give into it, and you want to not do that. Overflow incontinence is pretty much what it sounds like. Your bladder is full and it's too full, and as a result, it starts squirting out little amounts of urine. This is usually caused by some sort of like a blockage. So you see here the urethra doesn't look very healthy. It's kind of kinked up. This could be due to treatment for some sort of gynecological cancer. It can be caused by if your bladder has started to kind of fall, or your urethra can actually start to fall a little bit and it gets kinked, anything like that. There are surgical treatments for that where they can actually put a stent in here to hold it back open again, and then the muscles just kind of close it off the way they're supposed to, as opposed to an anatomical closure. What's confusing with this is that it might look like stress incontinence because it's that small amount of urine leakage. So it's not the full bladder emptying, it's just leaking out a little bit at a time. So causes of incontinence, there are numerous causes, but I've just put up some of the main ones. Weakness in the pelvic floor muscles. This is weakness that may be a result of childbirth. This could be weakness that's just a result of poor habits throughout life, weakness that occurs just naturally as we age. Unfortunately, as we get older, we naturally lose lean muscle mass. Our muscles actually just atrophy on their own, regardless of what we're doing. But by exercising, we can help to minimize that loss. Am I going to look when I'm 70 like I looked when I was 20 if I exercise? No, but I can certainly slow down the progression of that muscle loss. Not just in my, what you can see on me from an outside standpoint, but also on those internal pelvic floor muscles. Prolapse is another cause, and I'm going to talk about that briefly at the end, but I'll explain it later. But basically, it's just your organs kind of starting to drop, and as a result, that can cause incontinence problems. Bladder irritation. There are certain things that we drink that will irritate your bladder and cause it to contract. Our bladders don't like carbonation. They don't like caffeine. So if you go out to a restaurant and you drink a big old glass of tea or a big old Diet Coke, 20 minutes later, you probably are sitting there thinking, whew, I really need to pee. And it's not because you suddenly, the way that our bladder works is like, I don't drink 8 ounces of water and 2 seconds later that 8 ounces of water has gone through me and into my bladder. It fills at a trickle. It has to all get processed throughout my body, and some of it gets absorbed in one area and some gets absorbed elsewhere and the rest gets filtered. But what happens is when it starts to drip that caffeine into my bladder, that bladder starts doing this. It's like, whoo, I don't like that very much. And so as a result, you'll have to pee. So if you can avoid those things, or at least keep them to a minimum, then a lot of times you can reduce some of these problems. People that are drinking, 4 to 6 soft drinks a day, that is terrible for your bladder. I mean, it's terrible for a lot of other reasons. And I mentioned earlier, I'm not knocking soft drinks. I love a good ice cold Diet Coke from Sonic Happy Hour just as much as the next guy, but it will irritate your bladder and cause you to have some incontinence problems. Menopause and low estrogen levels, unfortunately, can contribute to incontinence because when we go through menopause and when our estrogen levels drop, it causes loss of muscle, but it also causes thinning of just the tissues in our vaginal area. So the labia start to kind of shrink up. The soft tissue between the vagina and the anus, which is called your perineum, starts to thin out a little bit. So all of those things now reduce just kind of the strength of what's holding up, and they reduce the tightness of everything down there. And so as a result, you no longer have as good a support system, and so you can start to have some leakage. The good thing is that very often these problems are managed pretty well with hormone creams. So things like estrase, Premarin, that sort of stuff, they work well to fluff that tissue back up. They'll make it look healthier. They can thicken the tissue with use over time. The problem is that if you've ever had any kind of hormone-positive cancer, you can't have those sorts of treatments. And there's no really good alternative on the market yet, but I'm hoping that eventually they'll come up with something, because a lot of women, unfortunately, have had breast cancer or GYN cancer that were hormone-positive, and so they get put into early menopause. They might be 30 when they've had everything taken out, or they might be 30 when they got, taken off of their hormones, and they start thinning out really early. And then decreased mobility, which is what I mentioned earlier. You just can't get out of a chair into the bathroom on time, and so it results in some incontinence. So what can you do? Perform your Kegels daily. And I'm going to talk about how to determine if you're doing a Kegel properly, how to know which position to do your Kegels in. And if you don't know what a Kegel is, it's basically just squeezing your pelvic floor muscles, and it was just named by Dr. Kegel. So that was it. The guy got to put his name on it for the rest of his life. Some people call them Kegels. It's the same thing. I guess it just depends what part of the country or the world you're from. Avoid constipation. People who bear down and have hard bowel movements every day or every 3 days if you're really constipated, all that downward pressure puts a lot of force on your pelvic organs, pushes your bladder right out, weakens the pelvic floor muscles. You know, it'd be like if I sat here all day long and pushed against this and did that for 5 years, eventually I'm going to end up with a big divot in my arm because the muscle just can't sustain against that. So minimize constipation. You know, high fiber, lots of fluid intake, even position changes. I mentioned earlier that using something like the squatty potty, I know it sounds like it was a joke when it came out, but there is actually some good research out there to show that using the squatty potty, because it elevates your knees, so it puts your rectum in a better alignment and allows for an easier bowel movement. I'm not an endorser of the squatty potty. I get no money from them, so. But position change, you can just put a stool under your feet. I don't care what you put under your feet. Avoiding bladder irritants, I mentioned the caffeine, the carbonation, all of that sort of stuff, keep it to a minimum. You don't have to fully eliminate it, because then people, if I say get rid of it all, everybody's like, oh no, and then they don't get rid of any of it. Just keep it to a minimum. You know, have a cup of coffee, but don't have 4 cups of coffee. Have a Diet Coke, not 4 Diet Cokes. And really, really keep that to a minimum later in the day, not just because of the caffeine and stuff keeping you awake, because you could be drinking, you know, decaf coffee, or you could be drinking decaffeinated Diet Coke, but it's still carbonated, so it will still irritate your bladder and cause you to have to get up at night to go to the bathroom. And maintaining a healthy body weight. Obesity will certainly cause more pressure on your pelvic floor. Like I said, we already have changes that are occurring throughout the years of our life with childbirth and just fighting against gravity and things thinning out and naturally getting weaker. But gaining weight just puts more pressure on those internal organs and causes an increase in incontinence. So what are Kegels? Kegels are specific exercises used to gain coordination, awareness, and control of the pelvic floor muscles. And I put those 3 things on there because it's important. A lot of women think they're doing Kegels, and when we test them, they're doing what I call the anti-Kegel. They're doing the exact opposite. So with a normal Kegel, if you were to look at your perineal area with a mirror, when you pull and do a Kegel, you should see the tissue lift up and away from the mirror. Some women, when we say do a Kegel, they push everything out. They're doing the exact opposite because that's the sensation that they can feel. They can't always feel if they're doing a Kegel. Or if you sit up right now in the chair and put your feet on the floor and I say do a Kegel, you should feel that vaginal area lift up slightly away from your panties or from the chair, okay? If you feel like suddenly everything on your bottom is contacting the chair, stop, because you're doing the Kegel wrong. And if you feel nothing at all, talk to me later, okay? The other thing is awareness. Like I mentioned, if you feel nothing at all. Some people have no clue. They're like, I have muscles down there. I'm supposed to be able to squeeze those muscles? Because unfortunately, most of the time you go to a gynecologist once a year, forever. How many times did they ever ask you to do a Kegel and say, oh, good, you're doing good, Miss Jones? They don't check you. And I get so many people, they might be, 50 years old, all their kids are, grown and they have grandkids now, and they're like, through all my pregnancies, through all my childbirths, no one ever checked if they were doing a Kegel, or even told them what a Kegel was. I'm amazed at the number of women who don't even know what a Kegel is. And then control. You should be in control of when you pee. It should not be the other way around, that your bladder is in control, okay? And by learning to coordinate and improve what you're doing with your pelvic floor muscles, you will gain greater control over your bladder function. So what are the benefits of Kegels? Increased strength and endurance of pelvic floor muscles. And I mentioned strength and endurance because I mentioned earlier when we do something like sneeze, that's a quick squeeze, okay? So those muscles have to know to fire right then so we don't leak on ourselves. But let's say I need to get all the way home before I go to the bathroom. Those muscles have to fire all the way home before I go to the bathroom. So it's not just a matter of kicking in with, for a 2-second squeeze when I sneeze or I pick something up. It's also a matter of let me walk all the way down the hall, down the stairs, out to my car without peeing on myself. So it's important that we build strength and endurance of these muscles, and I'm going to explain to you how to do that. The other thing is improved tone and firmness of the vaginal wall. Just like any other muscle, when you start to strength train a muscle, you'll notice that muscle starts to grow, that muscle starts to develop, you can see it better. The difference down here, you can't see them. I joked earlier in the earlier group, I said maybe if we got a flashlight or something and went down there, we could see something, but we go by feel. We do an intravaginal assessment on our patients, and on day 1, we know what it feels like, and then when we reassess them, we're checking to see, are those muscles thickening? Because what you want is over time, we start off, and your vaginal opening and that what we call vaginal vault might be like this. I call it a bat cave, and we eventually want it to be like this. We want those muscles to literally build up and bulk up just like every other muscle in our body so that they can do a better job supporting those organs. They can do a better job clamping off the urethra so you're not leaking urine, and clamping off that anal sphincter so that you're not leaking feces, okay? I mean, because who wants to leak that stuff? And enhanced sexual function. This may not be important to everybody forever. You know, at some point we're like, really, we still got to worry about that? But if you can enjoy it, and enjoy it more by strengthening your pelvic floor muscles, then why not? These are not, it's not an excessive exercise program, and just doing a little bit of exercise, because it tones that vaginal wall, you'll have increased sensation, and you can also have increased orgasm. I often teach, and I didn't mention this in the last group, but I often tell women, the first course I went to years and years ago, the instructor said if women would just have an orgasm a day, their pelvic floor would stay strong forever. So ladies, have at it. Amazon is your friend. And then decreased symptoms of incontinence, which obviously is what we're really talking about today. So self-evaluation. So, you know, I'm sure not everybody in this room has gone to a physical therapist to get checked for their pelvic floor strength. So how can you check it on your own? When we grade strength in the body, as a therapist, I can grade any muscle in your body, and I would give it a numerical score, anywhere from 0 to 5. A 0 basically means either you're dead or you've had a spinal cord injury. That muscle's not moving at all. A 1 would mean that you can contract it, but it's like a flicker. You can't contract it well. A 2 would mean that you can move whatever muscle I'm testing. You can move it all the way without gravity. A 3 means now you can contract that muscle and you can move it all the way against gravity. And then on other muscles in the body, it goes up to a 4 and a 5 depending on how much resistance I'm giving you. With the pelvic floor, we don't give resistance because they're tiny little muscles and I can't really push against them. But I'm just going to test their strength. So what we would say is you're going to do something called a stop urine test. But what I want to point out is when I say do it, you're only doing it once a month. A big mistake is that people believe that doing Kegels should be done on the toilet when you go to urinate. Okay? That is a terrible way to do your Kegels, because what happens is you confuse the bladder. It's like, I'm peeing, now I'm not peeing. I'm peeing, I'm done, no I'm not done. I'm done. It doesn't know what's going on anymore. And what happens is you will actually start to back urine up into the urethra, and you can give yourself a bladder infection. So don't do this as a Kegel exercise. Do it once a month as a test. So what you would do is when you go to use the bathroom the next time, I don't recommend this first, on that first urination in the morning, because your bladder's probably really full, and the last thing you want to do is try to stop it. Get that one out of you. But maybe the second time you go to the bathroom, start your urination stream and then see if you can stop it. So do what you think is a Kegel, okay? If you squeeze, you're doing your Kegel and you can stop the stream and there's no dribbling, so nothing's leaking out anymore, you've cut it off. You're at least a 3. We would call that fair strength. So you'd be that person that could move that muscle against gravity, okay? If you slow it down but you don't fully stop it, you would be a 2. All right, so it's weak, but at least it's alive. It's doing something. If all it does is a small deflection, meaning it kind of flickers off to the side, or it doesn't really change at all, then you're a 1. Okay, and this is important because in the next slide I'm going to show you how this translates into the position for your exercises. One thing also you want to note is if you go to do the stop urine test, and when you do what you think is a Kegel, all of a sudden your urine really picks up and comes flying out of you, you've done the anti-Kegel. Okay, so you would stop right there, okay? If every time you do the stop urine test, urine is really picking up on speed, then that means you are bearing down and pushing the urine out, which is not a Kegel. That is the exact opposite, and you would actually that means you need to be assessed and have someone teach you the proper way to do a Kegel. So individualizing your program. So let's say you've done your stop urine test and you went to do your Kegel and it just kind of flickered it off to the side, but you couldn't really stop it. You're a grade 0 or 1, so when you start your exercises, your ideal position to start would be with your hips elevated on a pillow. So if I'm lying on my back and my knees are bent up, I would put a pillow underneath my buttocks so that my pelvis is higher than my head. So what happens is when I do a Kegel, gravity is actually pushing those pelvic floor muscles in the right direction. So this is called a gravity-assisted exercise. So when I squeeze, because my knees are here and my head is down here, I squeeze and the pelvic floor muscles automatically go in the right direction, okay? If I'm a grade 2, meaning that I could squeeze, I could, cut off most of my flow of urine but couldn't totally stop it. That means that I could squeeze but without gravity, so now you can lie flat. All right, you don't need to necessarily raise your hips up. A lot of times we still say bend your knees just because it's more comfortable on your back, but essentially your pelvis is level with your head. So now when you squeeze and you do your Kegel, you're squeezing, gravity's not helping you, but it's also not hindering you. So it's no gravity assistance, but it's also not gravity resisted. Does that make sense? Okay. So if you were a grade 3, meaning that when you went to squeeze while you were doing your stop urine test and you totally cut off your flow of urine, then that means that you're strong enough to do it against gravity. So you can choose to do your exercises either in sitting or standing. Some people find it easier in sitting, some people find it easier in standing, but I always recommend that you start off where you're most comfortable, but then remember that you have to progress the position. So I mentioned you'll only do the stop urine test once a month. What that means is, let's say the first month you do it, if you go home today and you do it today and you're a grade 2, when you do it again next month, if you're able to stop your flow of urine, you need to remember that. That means don't do your Kegels lying down anymore. You need to challenge yourself and do them in sitting. Because what happens is if if I always did a 2-pound bicep curl and I never went past that, I'm never going to get any stronger. And eventually that muscle is going to adapt to that. And it's no longer going to challenge it at all. You have to kick it up a notch. You have to take it to the next level. So if you start out as a grade 3 today, and you start off doing your exercises in standing or sitting, then you would progress to doing them while taking a walk, while exercising, while jogging. I joke at work, and no one believes me, that I run, and when I run, I can do my Kegels. Now, I tell people I don't Kegel the entire time I'm running, just because it would make me run really slowly. But I, run and Kegel from one driveway to the next. And then if you can manage that while you're, doing a walking program, now do it from one driveway to 2 driveways down. Challenge yourself and make it harder and harder so that you're continually challenging those pelvic floor muscles, which will just over time continue to build their tone, continue to build their actual bulk, and improve their strength. So the next question I always get is, okay, now I know what position to do my exercises in, but how many should I do? And how often should I do them? When we evaluate somebody at our clinic, we determine their strength, and then what we do is we tell them, okay, I want you to squeeze, and I want you to squeeze and hold it as long as you can. And let's say you held it for 5 seconds. I'm going to say, okay, now I want to see how many times can you hold it for 5 seconds. And let's say they did it 3 times, and then after that they just couldn't do it anymore. They were doing like a 2-second hold or just kind of quivering. It wasn't really holding anymore. So that tells me that is the maximum strength and endurance of that muscle at that point. So I wouldn't go home and say, okay, so you did it 3 times for 5 seconds. I want you to go home and do 1 set of 20 where you're squeezing for 10 seconds. Why would I tell you that? You weren't able to do that on day 1. I've already figured out what is your maximum strength. So your exercise program then would be to go home, hold for 5 seconds, double for the rest initially, okay? So hold for 5 seconds, rest for 10 seconds, and then if you only did 3 successfully with me on that first day, you're only going to do 3 at home. I'm not going to tell you to do 6 because you can't do 6. And what's going to happen if I tell you to do 6, you're going to do the last 3 wrong, okay? So again, if you test or we test you and we say you held for 5 seconds, rest for 10 seconds, do 3, but I want you to do it 4 to 6 times a day. Okay? And that is not excessively time consuming. A lot of ladies will say, oh, I don't have time for that. All of that takes about 5 minutes throughout the course of a day. So don't tell me you don't have 5 minutes. One of my favorite times to tell people to do their Kegels is sitting in your car at a red light. I mentioned in the last class, there are tons of red lights around town and there's traffic at every single one of them. You could knock out 100 of these while you're sitting in the traffic. And there's nothing else to do. I also love to do it Kegel to the music. Put on a good song, Kegel for the duration of a song. An average song is 2 to 3 minutes. You can get a rhythmic pelvic floor going on. You don't necessarily have to just Kegel this way. You can just Kegel with the beat of the music. All of that will help to improve your coordination, your awareness, your strength, and your endurance. So it doesn't have to be boring and mundane. Incorporate this into what works for you with your lifestyle and what activities you're doing. Just make sure you're getting them done. And again, progress it. So week 1, you're doing 3 repetitions of a 5-second hold, a 10-second rest. Within a few weeks, you should be doing a 5-second hold and a 5-second rest. Don't give yourself quite as much rest. We start off doubling the rest because it's just like any other muscle. If I had you do, 50 squats, and when you finish those 50 squats, you're like, whoo, you get up and you got like noodle legs and you're not sure you're going to make it out to your car, Same thing right there. I don't want you to overwork your pelvic floor initially, and then you're worried you're not going to make it to your car without peeing on yourself the whole time you're walking to your car, okay? Those muscles have to rest just like every other muscle in your body. So make sure you give them a little bit of rest in between. But then once you feel like you're getting stronger and you're holding it longer, cut down on the rest so that it's now equal. If I squeeze for 5, I'm only resting 5. And then build up. You should be able to squeeze for 10. 10 feels like an eternity for a Kegel exercise. But there's no reason that those muscles can't hold for 10 seconds, because guess what? Rarely is it only going to take you 5 seconds to get down to the hall to go to your bathroom. So you need to build up to what is functional and practical for you. If your bathroom is way far away, you need to be able to Kegel and make it all the way to that bathroom. So you've got to build up that hold time. And then increase your repetitions based on how you're doing with your exercise program. The other thing that's important, you see here I got the tortoise and the hare. So we've got our sprinters and we've got our marathoners. All of this is more for endurance for those marathon muscles. So we have a lot of endurance muscles in our body. Our posture muscles are really endurance muscles. So it's allowed me to stand up here for 2 hours today without wilting and like crumbling forward as I'm talking. They're doing it on their own. I'm not having to think about that. Same thing down there. Those muscles are holding right now the whole time I'm standing here, and I'm not peeing on myself. Aren't y'all happy to know that I'm not peeing on myself? But if I didn't have the endurance to stand here for 2 hours, I might start to leak on myself. So that's why we work those. But just as important are these little guys here. The guys that have to kick in when I sneeze, when I laugh, when I misstep and move, lose my footing, anything like that. With all of those, it causes us to do this kind of thing. And as a result, they have to kick in and just squeeze for like 2 seconds. But it's an important 2 seconds, because you certainly don't want to leak on yourself every single time you sneeze, every time you laugh at a joke, every time you pick up your grandchild, all that kind of stuff. So that's why when you're doing these, you want to make sure that you're doing these held contractions, but then you also want to throw in these little quick, what we call quick flicks or quick squeezes. Our goal is that you would be able to do a set of 15 at a time, but test yourself. If you can't do 15, you can only do 8, start with 8. So that means 4 to 6 times a day, you would do 3 sets of a 5-second hold, 10-second rest, followed by 8 quick squeezes. Does that make sense to everybody? I know, once you start practicing on yourself, it makes more sense. But then make it harder as the weeks go by. Don't get to one point and say, okay, I'm done. And guess what? If this works and you start having improved strength and you stop leaking on yourself, do you get to quit doing your Kegels? No. I told the last group, if I came in and I had a rotator cuff repair and I went for my therapy for 3 months and they sent me home with a home program and I did that for another month or 2, and then I started doing it once a week and then I quit doing it, well, guess what? You're going to regress to go right back where you started at, okay? The beauty of Kegels is they can be done anywhere, anytime. I've been Kegling the whole time I've been lecturing. My Kegels are pooped. It's hard not to Kegel when you're talking about it. But you don't need special equipment. You don't need a special room. And when you're doing them, nothing should be showing on you, okay? I joke, I always pick at my mom, bless my mom. When I tell her about Kegels, and she's like, am I doing them right? I'm like, well, I don't know, but you're giving yourself a wrinkle. I said, this shouldn't be moving, okay? And I love my mother, but I'm not testing her Kegel. Sorry, I draw the line there. But you should not be squeezing your butt cheeks together. You should not be squeezing your thighs together, okay? So if you're doing a Kegel and every time you're doing a Kegel, you're doing this, you're not doing a Kegel. You're doing a glute set, which is great for your butt, but not helping your pelvic floor. So if you're doing a Kegel properly, which can be done anywhere, at any point during the day, no one should know you're doing a Kegel. So I expect everybody, when you get up from your chair, to Kegel and Kegel right on out the door and down the elevator.
So it's squeeze, release, and follow with 5 seconds.
And then the long hold. Yep. So I do want to mention, because I brought this up earlier, and this is a problem, and it affects probably about 50% of women over the age of 50. And I mentioned in the last group, if you haven't grabbed one of these, this actually just came out. In fact, I just saw it today for the first time. This is at the woman's table. It talks about different pelvic floor issues, and one of the big issues is prolapse. And prolapse is essentially a falling out of the pelvic organs, okay? So we're referring to your bladder, your uterus, or your rectum. And then sometimes it can be your cervix. It can be things like that. It can be the actual, weirdly enough, your vagina can fall out of your vaginal opening. And when I say falling out, I literally mean falling out. So if we sliced me in half like this and I looked at myself from the side, we're anatomically this nice little neat line, okay? So we have our bladder, Then we have our uterus and our rectum. And you can see they all sit up nice and perky. Well, guess what? You gain 50 pounds. You have a few kids that are sitting on there for a while. Well, all that smushes on this, okay? Or you have bad body mechanics. You get up out of your bed the wrong way every day of the week. You're a smoker, so you cough all the time. All of that puts pressure on all of this. And over time, it's no longer sitting perky like that. You see how your bladder from here to here, the bladder has fallen over. And then what happens is it gets into the vaginal canal and it actually starts to fall out of your vagina, okay? And I'm telling you, this is a pretty mild case. I've had patients come into my clinic and their bladder's right here, okay? I mean, it's not pretty and it's very uncomfortable, and very often it starts out just feeling like pressure or heaviness or this falling out feeling. It's best to catch it when it's just this kind of pressure or falling out feeling. It'll scare some women half to death because they might get up one day to go to the bathroom and they go to wipe and they're like, I have a tumor between my legs. It's not that they suddenly grew a tumor overnight. It's that their bladder just couldn't hold up anymore, or their uterus couldn't hold up anymore, or their rectum couldn't be held up anymore, and it slips out and it feels like a bulge. You feel something sticking out of you, okay? The good thing is, if there is a good thing about this, the good thing is that when it's caught early, very often just strengthening that pelvic floor and teaching you proper habits like getting out of the bed, lifting things, how to exercise, all of that sort of stuff can minimize it and prevent it from getting worse. Now, if you come in and it's already, hanging out of the vaginal opening and it's got to be put back in, that typically requires surgical repair. But I always recommend, just like if you go for a knee replacement, you wouldn't go get a knee replacement and not do some strengthening exercises afterwards. Same thing. If you go get this tacked up and held up, but you don't strengthen that hammock, guess what happens over time? It's going to fall right back out again, okay? So whether you require surgical repair of it or not, you need to do the exercises. You've got to strengthen that so that it has the best support that you can give it, and you've got to learn how not to push it down with everything that you do. Most prolapse is caused by, childbirth or stretching of the ligaments that hold it up, and just bad habits of people bearing down, people, coughing all the time, people getting out of bed by sitting straight up like this and always holding their breath, and every time you do that, you're pushing your organs out of yourself. So I wanted y'all to be aware of it. The other thing I wanted to mention is pelvic pain. Same thing in this little thing, it talks about the incidence of pelvic pain. And I discussed earlier, pelvic pain is kind of like a garbage can term in the sense that it's like whiplash. Pelvic pain refers to a lot of things, but some of the specific terms that fall under the pelvic pain category, one is dyspareunia, and dyspareunia just means painful intercourse. Dyspareunia is often a symptom of one of these other problems. Painful intercourse can be caused, a lot of what we see is painful intercourse after childbirth, and it's usually caused by some trauma to the tissue, an episiotomy or a tear, something like that. But painful intercourse can also be caused by muscle spasms. I mentioned these little muscles in your pelvic floor area, they're just precarious to get to, but they're just like every other muscle in our body. Just like you can get a knot up here in your neck, you can get a knot in those pelvic floor muscles. So vaginismus refers to muscle spasms of the pelvic floor. So someone with this may have pain with intercourse, or they might have pain when they're just sitting there. All of a sudden they get like it catches them. Or their bladder is full and they have pain because the bladder's sitting on there, and what happens is those muscles tighten up even more, okay? Levator-Aney syndrome, that's just basically the deeper pelvic floor muscles. I mentioned your pelvic floor muscles are in layers, so if you peel away the top layer, the next layer is the Levator-Aney group, and they are also around the rectum. So if you're chronically constipated, it might be because those muscles don't know how to relax. And then vulvodynia. I don't think I mentioned earlier, but vulva refers to the female genitalia. A lot of people go through life and they've never even heard that term. So, you have your vaginal opening and everything. The vulva is that whole area. It's your labia, it's your vagina. Vulvodynia is pain in the genitals, okay? And sometimes it's for unknown causes. We don't know why people are having pain. It may be that the tissue is irritated. These people can't use anything other than, pure cotton undergarments. They can't use soaps and dyes with perfumes and all that are all irritating to that area. So I just wanted y'all to be aware of those terms. And then what can therapy do? For painful conditions or for increased tone conditions, manual therapy. We'll get in there and massage the trigger points and the knots out of those muscles just like I'd be massaging a knot out of your upper trap, okay? Same technique, except it's a one-finger massage, so don't think I'm getting my whole hand up there, okay? Vaginal trainers, these are dilators. I joked earlier, I said it's not like a personal trainer for your vagina. That's what I do. But dilators are actually for stretching and massaging the tissue, particularly for you to do it at home. Exercise. If you come for pelvic floor problems, we're not just exercising the pelvic floor muscles. We're going to exercise your abdominals. We're going to exercise your postural muscles. We're going to do cardio and endurance exercises. So it's the whole spectrum of exercise. Biofeedback and E-stim. Sometimes if you come in and you're too weak and you just can't contract on your own, just like if you couldn't contract your quads, we would put electrodes on it and force the muscle to contract. We do the same thing intravaginally. We use a little intravaginal sensor that sends out an electrical signal, makes the muscles contract. Not like a contract. I don't want y'all to picture like sizzles and smoke coming out of your vagina. It's not that. It's very subtle, okay? And then biofeedback, because some people think they're squeezing. They can't tell if they're squeezing. They can't tell if they've relaxed. And so we use biofeedback to train them. So you're hooked up to a computer and looking at a screen. It says, okay, now you're squeezing. Now you're relaxed. Now squeeze and hold. Now you're holding it this long. Now relax it again. So it's a visual training method. And then lots and lots and lots of education.